So my experience began with something as simple as contact intolerance. It was probably about 6 months ago, just began noticing, and I had been in contacts for over 25 years of my life. So it was a very normal everyday practice, get up, put on your contacts, go about your life, and just wasn't able to somehow tolerate them. So initially began going to, the eye doctor that I had seen in Orlando, was classified, oh yeah, you're having some dry eye, cut out contacts, start doing more of the traditional treatments, warm compresses, artificial tears. Worked a little bit, but then slowly regressed to unable to wear my contacts at all, was prescribed steroid drops, Xiidra, all the conventional treatment methods. And by probably, after initial just intolerance, September, by December, it got to the point where I had pretty much gotten to the point where I was having a hard time just kind of getting through my days. Extreme sensitivity to light, blurry vision, intermittent blurry vision throughout the day. If I was working on my computer, working on my tablet, would have to take a lot of breaks, habitual use of artificial tears, and all these different treatments, just really didn't make it seem like I was getting better. And I had been from the initial treating doctor to another doctor, and they then did a scan of my Meibomian glands, and I identified that I did have, some Meibomian gland dysfunction, and was recommended to do a more conventional heat-based treatment from that. What was interesting though, I scheduled myself to do that, and the treatment, there's a device that they actually insert this piece around your lid margin of your eyes. They couldn't fit it in my eye. It could not fit in my eye. And they told me that happens maybe about 30% of the time. And there was nothing they could do, it just happens. And they also told me that I wasn't a candidate for probing. So I was told I have this, issue with my eye, but then there was no treatments other than warm compresses, continue using the drops, and sorry, this isn't going to work for you because we can't fit this piece physically in your eye. So it was really discouraging, because I didn't know what to do next. So thankfully, I, out of, I guess, from those frustrations, started just going online and researching, and I came across Dr. Maskin's website and just kind of read up a little bit more on his treatment methods with Meibomian Gland Probing and some of his research. I read his articles and studies and said, I'm going to give him a call and see if I can get in. And then that's when I was fortunate enough to get in and be seen by him. So my first appointment with Dr. Maskin, it's funny, I had always gone to doctors where, I thought maybe I'd be there for an hour, but when I called ahead, because I was coming out of town, just how to prepare, they're like, he's gonna spend a lot of time with you. So I was like, okay, great, how much time should I allocate? They're like, it could be throughout the day, plan, block my day. So I was pleasantly surprised, kind of intrigued what exactly that entailed. So, but immediately, the whole entire staff, very warm and welcoming. I mean, when you're on this journey and you've gotten to the point where it's affecting your life, or from a physicality standpoint, from a, almost, creating this sense of anxiety because you just feel like every day you're having a hard time getting through your day because of the pain and what's going on with your eyes. I felt instantly a sense of at least relief because everyone here understood what I was going through. So that was definitely a comforting place to be. Upon meeting with Dr. Maskin, he did an extensive intake process. It wasn't just about my eye. He really looked at me just from a holistic standpoint, what my medical history was, what were things that could create some of those comorbid factors that could not only be, yes, the Meibomian gland piece is a part of what might be going on, but here's some other things that could be going on. So I just really appreciated the depth and time that, a specialist like him took, investing in my health, because I at no point felt rushed at all. So after the intake, the team did a series of tests, very basic, just looking at my eye, managing or looking at my tear film, just looking at all those different pieces, and then they even sent me to do my own meibography. Sorry, that's never rolls off the tongue well. As well as then the confocal the confocal, and from that, I was able then to be walked through. What I really appreciated was the being able to see what was going on, but then the detailed explanations behind it. Because again, I had some limited knowledge from where I had been and came about, there's an issue, but here's what we can't do to treat it. Versus this seemed like a very transparent process, like here's what's going on. I'm going to show you, and then I'm going to walk you through what exactly is going on here. And then I'm going to make tailored recommendations based on what I think would best benefit your case. This wasn't, this is this, so then you do this, because I felt like that's kind of what I had been. Like, this is level 1 treatment, level 2 treatment, whereas this I felt was much more individualized and tailored to what was going on with me. So after doing, the extensive testing, it was deemed necessary that same day, which again, I came here for relief. So I was so appreciative to have, the doctor willing to do some of these in-off procedures on me. So I had the intraductal Meibomian Gland Probing, where he, numbed me and went through and did the probing, as well as then doing the steroid injection throughout my eye to help reduce any of the inflammation that they saw, based on my case. And then following that, something that actually I had been misdiagnosed prior to, that I had been previously told there was nothing wrong with my watery tears. Whereas here, after doing testing, I was told that I had 0 tears. And I was like, is that possible? And, I learned, yes, that's possible. So Dr. Maskin then made the, decision, which I agreed with, that we should look at doing some level of cauterization to my tear ducts to preserve the tears I have, versus plugs, which, I had read about, and I agreed that, there can be a lot of challenges that arise with those. So, I felt comfortable given the extensive time that we spent together that day and the detailed knowledge that I knew he had now about me, as well as his background, to where I was like, okay, this is something that we need to do. And, was, able to do this all in one visit, which was actually incredible. And then was able to be seen 1 week post to just get, a baseline of, okay, here's how now you're looking 1 week after all these different treatments. So the procedure being probed was, I didn't know what to expect. So I, of course, instantly I'm like, well, there's going to be numbing, right? So they have this, I think it's almost like a bandage contact that they put over your eye with a numbing agent, and then they put a numbing type of salve around your lid margin. And I remember, I think I was for about 15 minutes, numbed, and he wanted to make sure that I was good and numb before we started the procedure. And, I was ready to do it. So I think that also helped too. Like, I was ready for the relief. So even though I think I personally was a little anxious because it's something going on with my eye, I was able to, be focused on that, and, knew this was the treatment that I needed to have it be done. So Dr. Maskin, he was extremely precise. As soon as we started the treatment, he instantly, began, very quickly, going, gland by gland, and I could hear either when there would be that audible pop, or I could feel when the pressure was being relieved. And I think that was kind of a driving factor to me, like, okay, this is gonna help. This is something that, even though I might be a little, nervous, because this again is my eyes, that, I was focused on making sure that this is what I need to have done to feel that relief. And it was relatively quick. I can't recall for both eyes, maybe 20, 30 minutes. I can't recall. It was probably a half hour total. And then when I was done, went to another room and then began the process of, removing the contact bandage lens and cleaning my eyes up, so. The day after, I definitely began to feel, it almost felt a little lighter. Like my eyes didn't feel as heavy, because I think, when it was at its most extreme, I was having those heavy, tired eyes. But yeah, I definitely felt like my eyes were lighter. There was no sense of pressure, no pain. I could tell immediately there was a reduction in the sensitivity to light, which for me was something that was pretty extreme. So I, just from those 24, 48 hours, I could feel marked improvement. And I was really just blown away and excited. And every day, he gave me a very specific, post-treatment, protocol to do. So, but it was very doable too, doing a saline rinse, on your eyes every night, and, putting just, the ointment on your lashes, just very manageable. And 1 week later, post op, I came for my follow-up, and from my glands, I remember I had one lid that only had 3 glands open, and from within 1 week's time, I think I went from that to like 16 glands, in just that one lid. So from a physicality standpoint, as well as just, I think for me, just feeling good about knowing that now, like, I'm on the right track. Whereas before, I honestly almost felt hopeless. Like, here's all these different doctors, giving me these things, and nothing was getting better. And then I was told this one specific treatment was like the industry standard treatment, but yet I'm not a candidate because it doesn't fit in my eye. So I was just really, thankful and encouraged to see not only the direct physical results of what I had done, by Dr. Maskin, as well as I really have felt this entire time that he's been a true partner and advocate, taking a personal interest in my health and the outcome of this, so.